A study has found that UK citizens die sooner from cancer and heart diseases than people in other rich countries. The main reason is stated as the lack of beds and staff. According to a report by the King's Fund Thinktank, the NHS has been affected by years of underinvestment, while adding the number of avoidable deaths could have been prevented had patients received better treatment. The study includes 19 rich countries, and it concluded that Britain has below average health outcomes because it spends less. The report compares the resources available to the NHS across the UK and with those of the health systems in countries including France, Germany, Sweden, Japan, Singapore and the US. Apart from this, the King's Fund also acknowledged that the NHS's lack of doctors and nurses is another one of the main reasons as to why the service is struggling. Later this week, the UK government is also expected to publish its long-awaited reports on the NHS. The UK Prime Minister Rishi Sunak touted it as one of the most significant announcements in the history of the NHS. Well, for more on this, we're joined by our correspondent Alex Isat in London. And Alex, this is quite a shocking report. The NHS is obviously world famous, but is in not good state at the moment.
Absolutely not. Sadly, it does seem to have been crumbling apart for the past few years. Now, that report also states that it's not just medical staff that the NHS in the UK is lacking, but it's also equipment and facilities, things like MRIs, scans and extra beds, those things that the NHS should have, especially for a country as rich as the UK that's just not having them. Now, Rishi Sunak, Prime Minister, did say that we were going to get 50,000 extra nurses, trying to get them, encouraging them into the NHS workforce, but the workforce has been declining, specifically as well since COVID, when a lot of nurses decided that they were going to leave the profession. They were working over the hours that they were meant to. They were doing zero contract shifts, and there was a lot of stress and anxiety within the role itself. You know, we have seen here especially the strikes from the nurses, from the NHS, from the staff, ambulance workers throughout the last couple of months, and those conversations about junior doctors striking are still ongoing. So there is a lot of problems with the NHS itself, and whether or not there's billions of pounds, there was talk from one of the health secretaries that there was going to be billions of pounds put into the NHS, but it is the people, and if those people aren't coming, then unfortunately the NHS is not going to survive. And at the moment there may well be 50,000 nurses expected, but there isn't actually a route for them to come on board. From what I understand, a lot of the universities who are trying to teach new doctors specifically are also pandering to a lot of these alternative ways of teaching. I was speaking to a doctor up in Nottingham, and she was teaching and said that there was already a trigger warning on some of the doctor classes that there may well be blood shown, and that is a worrying concern for our future doctors. If they're going through university, are they going to be finishing if that's not really the career they want? So it does feel like the NHS is slowly falling apart, and today we heard as well that the independent review suggested that there should be a pay rise of up to 6% for NHS workers going on from next year, but the government has not said whether that they will implement that. And although obviously the Conservatives may or may not be in power this time next year, the Labour Party as well, who would be the next alternative, they haven't said whether or not they would give that 6% as well. So there's a lot of problems within the NHS. It isn't just the lack of people, it's the lack of equipment, it's also how people are being dealt with on day to day. So surprisingly, although this is quite a sad report, it's not that surprising.
Alex Isaac joining us live there from London. Many thanks.